Liver compression technique.
Yeah.
Yep, you're good.
So first of all, where is the liver? Well, first of all, it's on the right side in most people. And and the liver is protected by the rib cage. So you want to get a vague idea where the lower end of the rib cage is. And then the liver is a rather large organ. It's the largest organ other than the lungs. And so you place one hand on the back of the liver. So the palm has actually ribs that is touching, not the soft part of the low back, but it's under the lower part of the rib cage. And the other hand is lined up so that the direction of the push that I will do is aimed at a point sort of halfway down from the belly button. So it's an angle that I'm going to be pushing towards the belly button, but also deep. And it looks like this is a bit uncomfortable because I need my whole body weight, and this is how it looks like.
Are you pulling up as you're pushing down, or
No,
just holding it steady?
There's no pulling. It's just, I'm really compressing the liver, ideally with the idea to make it as flat as a stem.
With your fingertips or with your palm?
No, the pushing is with my palm, with the soft part. And
Sorry.
so sometimes, if the distance to the breast is short, there's, you have to kind of warn the patient. And if the patient is too old, there is a risk of fracturing ribs with old osteoporotic people, so I would not start there. But most people with a congested liver are young people, and it's all of the children. It's fantastic how you can improve the mood of a child in 3 minutes. Yeah, and I want you to really get a visual. I am really compressing the liver. I'm not just, it's not a little, it's like CPR, I worked in the ER, and when you do CPR, when you really compress the heart, you're going to save a lot of lives. But if you do the fake CPR that you see on TV, people are not going to make it.
This technically could be done during the liver gallbladder flush.
Totally.
Well, we do. We teach people when they do the gallbladder flush, while they have the olive oil on board. And so 3 minutes, as you will see, is a long time. It's not a long time out of the day of people, but it is a long time. The ideal time to do it, the gallbladder naturally squirts when we taste food. That's when it starts squirting, when we have the taste of food. And so the ideal time is like you start a meal and halfway into the meal to do this, because that's when the natural squirting is of the gallbladder. Or the maximum time, in acupuncture, is at night. So to do it as late as possible.
Wake up at 3 a.m. and do it?
Well, no, I think it's 1 to 3 o'clock at night. But I have moms do it as the child goes to bed and naturally lies down. Mom does this procedure for 3 minutes, and it's wonderful. And we preload the system ideally with chlorella. So most of our kids love crunching chlorella, and they love the crunchy things. So I get that as a reward. And so we give them, in the hours before, we give them a good whack of chlorella. It takes about an hour and a half to 2 hours from swallowing chlorella before it lines the small intestine, the duodenum where the entry is of the bile duct. And so you want to have some chlorella there, or zeolite, or the we call it microsilica, the IMD, or any of the other binding agents. So because there's no point in draining the liver of bile and stagnant bile, of the toxic residues that are in there, because most of them are neurophilic. That means on the way down in the small intestine, they're all going to get reabsorbed and make another entry into the liver. And so we only do this procedure in conjunction with having as much binders on board as possible. But they don't have to do that for days before. It's enough 2 hours before to take a whack of chlorella, maybe an hour before also. And then, ideally, around dinner, maybe a minute and a half mid-dinner is great. And then another minute and a half at bedtime. That's sort of the optimum that we found. I'm sandwiching the liver between my hands.
Okay.
And I can just vertically compress. I don't give it the direction. And most of the bile ducts are in the direction diagonal towards the belly button. They're lined up that way. There's 2,000 miles of bile ducts.
I thought you were pushing towards the belly button. You're not?
No, to a
Straight
point
down.
deep to the belly button. Yeah. So if this is my body and here's the belly button,
Yeah.
the direction of the push is in this direction, but down.
But down, yeah.
45 degree down.
Yep.
So by doing that, we're squishing. If this is the liver between me, I'm flattening out the liver, but with the push in that direction. That's most bile ducts are lined up in that direction. It's like squeezing toothpaste out of an old tube of toothpaste that has gone a bit thick and stagnant, and so we're squeezing it out that way. And there is valves in the bile duct, so whenever you compress it, the bile doesn't go backwards, it goes forward, you know.
And it's with your palm, and it's on the ribs in that direction.
Yeah.
So you're in
You have on both hands you have bone underneath you. If you have
Perfect.
soft underneath you, you're too far down. You have to have bone underneath. And
Perfect.
and it's really as simple as that. The only thing is if you have somebody who's my age or even older, who kind of looks osteoporotic, you know, sort of, you may want to do this much more gentle. And in children, it's like a soft balloon. You can exactly feel the liver. You can feel initially how it is harder than it should be. And very often we see worms and worm eggs. The next poop they have, or within 24 hours, you see parasites coming out. So you get the same things appearing in a poop that you would see with a good parasite treatment or with a good gallbladder flush. I mean, I love coffee enemas in addition and castor oil packs, but it's just a desperate mom with an autistic kid and she wants to start somewhere. And the kid is fighting off everything, you know, that throwing off the castor oil pack, don't let you do coffee enemas. This is still an entry point where within a week or 10 days the child becomes much more cooperative and it opens up the whole ballpark, you know, of other things that you can do.
once a day or
Once a day for about 3 minutes. Now we haven't experimented with longer times and doing it more frequently, which I wouldn't hesitate in somebody with hepatitis or more serious conditions. You know, I've done it with liver cancer. You know, we treat liver cancer. I mean, I can say that here with strong doses of injectable antiparasitics with fantastic results. But to get the uptake in the liver increased of the medicine, you do the same procedure because you're emptying it and it sucks in fresh blood into the liver cells and squeezes out stagnant bile and toxic bile on the other end. And so you can detox the liver that way, you know, for whatever the reason is.